brother Raj Prince Mara, your able host for you all on Project Media. This program is proudly sponsored by Project Media and its partners. Not forgetting to be part of our show by subscribing and also following us on our all social media platforms. We're going for a quick commercial break. When we return, the e-talk charts is up next. Stay tuned.
Wow. Like the sun and cause you do all the yeah, you open the door when you pick
Project Farms, the best. Call us or WhatsApp us now.
Welcome back from that quick commercial break, and this is still up on Project Media. And to our very first story, we have the Minister of Health visiting the Tamale Technical and Teaching Hospital. Actually, unannounced, he stormed there to check what is happening in the hospital over the patients that died last week on the 22nd of that month. So this came to our notice where the minister was also on heat, asking a lot of questions in the hospitals where people were also, shouting at the minister that you should have told us that you'll be coming in. You can't just come unannounced to come and sack our boss, Mr. Atiko. So our minister, Kwabena Minta, visited the Tamale Teaching Hospital. But I have here with me in studios my special guest. We are about to discuss this, but before that, don't forget to share, like, and also comment on this video that we're about to share after our segment of discussions. Stay tuned.
Even the minister, me, look at the way you are behaving in front of me. So you can imagine how I'm trying to explain. You can imagine how you
How long have you closed this place? I mean, even the corridor doesn't have lights, right? The one you do, you know, that's
So what it means is that anybody who comes here will not have access to the washroom. That's what it means.
No, they will have to move to the one at Orange.
I'm saying that.
Yes, but
you told me that there's one here and there's a staff.
Yes.
The staff also have one. And that's why you brought me here to come and see.
Yes.
Is that not the point? Yes. Meanwhile, it's not accessible to the patients.
No, it's only accessible when the taps open.
So
that's the situation. So for a while now, water hasn't been flowing in there. And that's why I wanted you to see. You see that there are sachets. People enter there and they use sachet water and then just dump it there. And that's the situation.
at least, even if it is not being used, they can't clean the place and lock it.
There's no water.
No, you can clean the place and lock.
There's no water to scrub the place.
You don't have water to do anything. You can't make arrangements for the tankers,
yes.
the tankers to bring water, and so you don't have that arrangement. Dr. T, you are telling me that you can't have water for this place to run this facility.
Let me vouch for my boss a little bit. This is Dr. Valentine, he's the HOD of the emergency. And one night, we didn't have water at the emergency, and he himself got them to get the yellow barrels to come and bring water for the nurses to work. So, at our level, sometimes my HOD does his best.
Yes, Doc, I agree. And I'm the first person to admit that there are challenges with respect to water in Tamale. But that's why you're a leader here, that's why you're a CEO here. Not until we resolve the issue completely. I've been on the committee for a very long time, and we have always been talking about this. And we think, we know that you have a way of providing water for the facility until we solve the issue permanently. And that is what you have been briefing us. We know that the Tamale water challenge goes beyond the facility. It's well known in the country and all that. But you cannot tell me that, because if you are not very careful, people come here and pick the diseases from here and go home. That's what it is. And you know, you're a medical doctor.
Yes, sir.
So they will come here because there's no water. The person is sick. He comes here and picks the disease and he goes home because there's no water.
So we have the two tankers.
Good.
I think the last week they went the whole day. They were allowed to 4 trips. That 4 trips alone cannot dialyze take care of the dialysis unit for a day. Because when you open one dialysis machine, like you open a tap. So the 4 tankers a day is not enough. So when the water can prioritize, we have the public the toilet that we have for patients. So if this one is locked, then they'll use the public one. It's outside, it was built by GMPC. So maybe on the way we will pass there. Only it's a bit far from here. But
I've come because of you, don't worry. Let's proceed.
That may anger people around. So please, the medical doctor.
You see, we want a solution to the problem. We have to be honest and discuss the issue. That's why I'm also trying to come back. You see, we have to be sincere about the fact.
So, Dr. T, where else? Because I need to have a meeting with all of I am trying to contain the situation. When you put up this behavior, even the minister, me, look at the way you are behaving in front of me. So you can imagine how, please, you can imagine how you treat a common person.
I mean, with this attitude even to your superiors, can you imagine how you deal with common people? And that's why it creates the problem. That's what will create the problem. And even with your superiors, look at how you are arguing.
There's a problem. There's a problem here.
So if a commoner comes here, can you imagine why you?
How can somebody talk to this man here? How would he?
I don't know if a civilian comes here, how could you deal with such a person?
Okay, good evening, how are you? Please, how are you doing? Okay, I welcome you to Europe, and today we're discussing about the health minister that visited the Tamale Technical Hospital, which he sacked their CEO. It was very bad, but the people are talking about, is it right for him to go there and sack the CEO, Mr. Adam Pettigo?
I think he was in the right to do that. I wasn't there. I can't say to the conditions in there. According to him, the conditions were very deplorable. He couldn't just, he had to do something about it. So he had made a step forward. It may be bad, it may be rash, but he had done something about it. Something had to be done, he's done something about it. That's my show.
Okay, that's Mr. Paul. We have another lady here in the studio, so let's ask take of the dismissal of Adam Pettigo, the Executive Chief Officer of the Tamale Teaching Hospital. Is it right for the minister to first be at the hospital without notifying and also telling the people of the staff that he will be coming to the hospital to do something? Is it good for him to do that?
Behavior towards work sometimes not at the best. So now the right thing we did. At least we wanted to know what is going on in the hospital. Yeah. So I think it's the best.
Okay, and you know, some people are also saying that the sacking of Mr. Adam Pettigo will also have a dimension of the Tamale because nobody is going to replace him. Is it good that there will be a quick reshuffling of somebody replacing him, or we should just hold it in?
I think there should be a quick reshuffle so that the management also
That's
we may have a deputy. So for now, I think the deputy is stepping to what we call it, handle the duties. Until the substantive somebody is chosen to step in. I think the deputy will be fine.
That's very good. So on this note, we'll be going for a quick commercial break. When we return, there's another security updates on the stay tuned.
Like the sun and the moon in the sky, boy, you're making me shine. Like the sun and the moon in the sky, boy, you're making me shine. Cause you do all the things that a girl like, yeah. Yeah, you open the door when you pick up. And yeah, you open the door when you pick up. And you like the sun and the moon in the sky, boy, you're making me shine.
Welcome back from that big commercial break. If you just tune in, this is He Up on Project Media. Still on our story about the sack of Chief Adam Etiko in the Tamale Municipal Technical Hospital. So on this note, we are just here to talk about the conclusion of the story. Actually, we want to know whether we want to hear a good thing, whether being the best for him to change the hospital or bring in good things into the hospital. So I have Mr. Paul here. Let me go to him and let me ask his advice on the show.
I didn't understand that.
Okay, Mr. Paul, I was trying to talk to the public that we are here to advise them that the hospital, although the chief executive is being sacked, but the hospital is still running, and to the nurses and the people that are already there, which hasn't been sacked, we're here to say to them that they should keep on the good work, because the hospital is where we go and get our health care. But if the hospital is not there, then we are there as humans. So we're here to just advise the public for them to attend to the hospital, even if things are really not going well with it.
I think we can't shun the hospital, because when you are sick, you need the best of facilities to attend. And I think at Tamale, that is the best hospital around the municipality.
That's true.
So I don't think the public can shun it. The nurses, looking at what the minister just did, would also up their game, that you cannot sleep on the job and still be at your job. So I think that is, I'm in full support of the minister for that. I'm in full support of the man.
So
The
Mr.
sacking of the director of the hospital is in the right vein. He didn't do it, according to the minister, he didn't do the job right. So when you are held to some standard and you don't need a standard, it's just right that you are taking off and give another person given the opportunity to do better than you have done. So I'm in full support of the minister's actions.
So what's your advice to the public at Tamale?
Yes, my advice to the public is that when you see something, say something. No matter what you see, just say it. It may be good, it may be bad. When it's good, the person who you saw the thing about may be approved and promoted. If it's bad, say it, and necessary action to be taken against whatever you saw.
Thank you very much, Mr. Paul. So this is the voice from Mr. Paul. When you see something, say something. That is advice to the people of Tamale. We're going to our left side in the studio B. We have Madam Joy. An advice to the public, actually.
Okay, so this should be a lesson to us all, because I think the minister did well in doing what he did. Yeah, so it should be a lesson to us all. We sometimes feel reluctant on the job. So what he did is the right, is the best. Yeah.
And I think
Yeah.
I think my advice to the public is that say something. When you see something, say something. You go somewhere, they don't treat you right, and say something. Somebody can get up and, based on what you said, act on it and improve what you saw that isn't up to your standard you want. I think that is my advice to the public.
In full support of the move our minister, Mr. Kwabena Minta, has actually done. Mr. Adam Etiko, the executive director over the Tamale Teaching Hospital. It was very bad, people talk about it, but viewers, this is for you. You can draw down your comments on our comment sections so that we can read them for you. And this is where we really want to draw down our curtains. Not forgetting to subscribe to our channel and get more updated. And this program is proudly sponsored by Project Media and 8 partners. Next week, we'll come with another segment on the show. Stay tuned. Bye for now.